Hello everyone, this is Saad Abdul Jabbar, and today I'm presenting current event number 6 and 575 current events in healthcare. And this presentation is about quality measures to improve medical billing. As we all know, healthcare costs are still on the rise, and billing errors are one of the factors for that increase. Hospital billing accuracy is a form of medical quality that can be monitored. As medical errors that also can be tracked and monitored, the same thing for medical billing. Improving the quality of medical billing provides a full patient-centered process that can actually calculate for benchmarking with other facilities and the quality performance that they provide. Billing errors may also have a huge impact on a healthcare organization in many forms, such as wasted resources, lower customer satisfaction, and bad credibility. Quality measures that determine medical billing effectiveness will significantly enhance patient financial experience and outcomes. So let's start this presentation by defining what is the what is medical billing and what its complications, its problems that billing department may face, ways to avoid the medical billing problems, then the 5 proposed quality measures to track and improve medical billing quality, and then a conclusion. Medical billing. Medical billing is a process of filling and monitoring requests or claims to receive payments for the services provided by healthcare practitioners from different insurance companies. These medical billings turn a healthcare service into a billing claim, in which the medical biller's job is to address these claims to guarantee that the organization is reimbursed for the services the healthcare professionals provided. Medical billing and coding specialists are mostly responsible for making sure medical office revenue cycles run as smoothly as it can. When a service is performed or a procedure, a medical coder assigns codes to the services provided. The diagnosis and procedure codes are taken from medical record documentation, and these documentation such as the transcription of a physician's notes. Also, it can be from lab and radiology results, and so on. So there are thousands of medical codes that billers and coders use to process patient claims. And also, so what medical billing is used for other than patient claims? It's used for defining diseases, illnesses, also signs and symptoms, abnormal findings, and again the claims and any complaints from patients, and various external causes of disease or injury out there today. Medical billing problems. Medical billers have thousands of codes that makes it impossible to memorize all of it, while also knowing that medical billing can be different for each individual patient, for each different insurance and different procedures, which makes it hard to experience denial-free claim. So it is important to notice when the department is having financial difficulties or if the department is losing many patients. This can be one of the reasons, which is having high costly billing mistakes. These billing mistakes include insurance errors. So there are a lot of different insurance companies that a patient can go through. Even sometimes in 1 year, a patient can switch from a specific insurance company to another company that actually have different coverage. With the most important step that must be done at every visit, the front desk can take to avoid the issues like that is verifying the current coverage or the current insurance the patient have, and determine whether the service is they seek are covered by the insurance company or not, especially the one that they have right now they're using. And they should the front desk explain to patients that this is really important step to avoid unexpected bills that they might have, and making sure the services uh, is going to be paid for. The second one is the lack of attention to details. Claims can be easily rejected for misspelling a name, policy number, or dates, or when multiple insurers are involved. And these issues may happen because of the lack of attention and distraction around the billers while they are inputting the data. So having patients complete forms online can increase the accuracy, while also having the staff members in the billing department responsible for billing need to have undistracted time to complete their duties, to complete the correct data. The third point is coding errors, where each diagnosis must be coded to the highest level for that code, and that code must exactly match the procedure that is performed. But they can also not be coded beyond what was actually provided. It requires a highly educated billing staff using updated code book and updated system to account for all the new changes instituted by the various claims processes. And then following is the miscommunication. It comes after as another issue. Provider might inadvertently give the billing department an incomplete description, or procedure might be cancelled without notifying the entire staff there. A bill goes out incorrectly or needlessly, leading to more problems down the road. Then the delayed filling. The delayed filling can cause the organization to take the risk of losing revenue for the practice by losing the papers in the system, or resubmitting a rejected claim in a timely manner. Then we have the duplicate bills, which are usually the result of some type of human error. The billing staff might send another claim because they did not see the first one, or a procedure was rescheduled but it still shows up in the system under the patient records twice. It could even be that a similar procedure, but it's actually different procedure was applied, but the billing staff does not recognize the difference and gives both the same coding. Then we have the bundling. Some services that are performed together are meant to be built as one. However, this is lost somewhere in the transition from one to the other, and each subunit is built separately, resulting in a higher total claim than what would have been allowed under the bundled code. And finally, we have the poor protocols, which has the it's another key mistake, is failing to maintain and review the receivables aging report, And this shows the claims that are unpaid and brings more actions to take. Ways to avoid medical billing errors. So other than the suggestions in the previous slide, a training can be provided by giving the department a list of protocols regarding the billing procedures, and also providing continuous or ongoing training to the billing department to keep them up to date and any changes that might occur. And then we have remove distraction, which is by letting the billing department concentrate on the job they have, by not giving them other responsibilities, especially responsibilities that are not related to their primary duty of filling the claims. And then keeping up to date with codes. By making the department understand the latest coding requirements and knowing what it might result in if they were not having up-to-date coding. And then communication. Communication, as it is one of the main problems that we discussed in the previous slide. It should be improved, the communication between healthcare providers and billing staff, to ensure a clear understanding of the patient visit, what they had from procedures and other services, and also noting any cancelled, rescheduled appointments so it won't get billed twice. And then communicating also with patients. Communicating with patients clearly in case a billing error happened, and outline all the steps taken and show patients the importance of providing accurate information and up-to-date insurance policy, and again what it might cause if it wasn't. And then the time frames, having clearly outlined time frames for submitting claims, addressing any errors, and following up on unpaid claims. And we have the last one, partnering, which this could be the easiest way to avoid all these problems involved with the billing department, is to partner with a company that has experience dealing with all the major insurance companies and can automate the process, so the organization doesn't have to worry about it like at all. What medical billing errors may cause. If the billing system was not monitored correctly and was up to date, procedures or poor management by practice administrators can result in any number of negative impacts, ranging from bad to worse, starting with the time wasted at the beginning, where billing errors may result in a huge waste of time, as the same task is performed again and again, not generating additional revenue for the organization. And then we have additional staff. So in case a claim was rejected, become big enough, the new claims do not get handled at the right time, and the practice is forced to bring on extra staff for an additional expense to deal with the build-up claims. And then we have the delayed payments. Delayed billing and rejected claims makes it impossible to accurately project cash flow, while the delays might all be quite reasonable. And then we have a poor revenue cycle management. This process tracks revenue through the entire patient cycle, It begins at the time of an initial appointment and concludes when the final balance due for services is actually paid. So short revenue cycle management is desirable, while long cycles suggest that there is an issue with payment processing or collection functions. And then we have angry patients. So it's clearly difficult to explain to patients why a claim has been denied or it's late being paid, where they will think about unplanned out-of-pocket expenses, where they might have done this already too, which makes it two out-of-pocket expenses for the patient. And patients hardly will ever return to the organization. And in the worst cases, they will spread their negative experience to all of their family and friends about what they had from an experience with the organization. And lastly, we have fines and audit. If the billing errors are considered to be fake or fraud, it can result in an investigation or audit that can cause a loss of time, lasting damage to the practice reputation. So if the practice is found to be at fault, it can even result in legal charges of fraud being pointed. And this can result in fines, loss of licenses, or additional legal expenses to deal with the outcomes. Quality measures to improve medical billing. So, in an effort to help address this growing national problem, two physicians at Johns Hopkins Medicine, Simon Matthews and Martin Makary, have proposed 5 quality measures for medical billing. The first quality measure introduced was the price transparency, which is if the organization provided the cost of procedures in a clear and organized way or not to their patients. While bills have been used in medical codes and terminology in the past, patients must be able to understand these details they have been provided with. It should also be readily available by patient demand. While some U.S. Medical centers provide prices for these medical services, others do not, which result in poor care quality, which is a really important step toward patient-centered billing. So are patients provided with real prices services when they ask or not? The second one is the service quality. Can patients speak with a billing representative about a concern they have about their bill and be informed of a transparent review process? This measure recommends that a healthcare organization track if patients have the right to speak with an appropriate individual about their bill concerns, and making sure patients have this resource can prevent errors, can be corrected, and provide recommendations to patients before the problem arises. And this also may stop the issue of patients feeling neglected when it comes to discussing medical bills. The third one we have for the quality measure is suing patients over unpaid medical bills, which is a violation of the core mission of hospitals. Does the organization sue patients in order to pay for their salaries? Do they withdraw money from patients' income tax, and so on? And then we have the surprise bills. And are out-of-network patients paying out-of-pocket expected to pay more than the region-specific? The measure addresses the double standard of expecting patients who are paying out-of-pocket to pay more than others for the same care. And then lastly, we have our patients charged for complications. So our patients billed for complications and such as directly complications that were due to a serious uh, adverse event. This may include making a surgery in a wrong site in the body or operations to remove a retained foreign body. In the end, the healthcare industry is highly regulated in the United States. After all, it is one of the leading topics during presidential elections. Billing quality is considered to be a healthcare quality. Billing mistakes result in late payments from insurance providers, rejected claims, and added discomfort for patients, and reduce the overall quality in the organization and the organization reputation as well. Mistakes can happen, but avoiding mistakes and continuously improve, update, and monitor the process of medical billing will reduce unwanted complications in the future. And this is the end of the current event number 6. Thank you so much for listening and see you in the next one.